Hi, all. Thank you so much for joining in today. Now, before we go ahead, we start all the discussion and all, I will definitely make it interactive. But before that, just a thumbs up if you can hear me. Okay, cool. So, um, now today we are going to start with basic periodontal examination. But I really want to know, how do you rate your perio from 1 to 10? How much will you score to your periodontology knowledge and all? Okay, maybe 5, 6. Others? Mm-hmm. 7. Okay. So people who are not replying, that means their perio is 0. Should I consider 0 for them? Okay. 5 is 6. 5 or 6 or 7 is really good, I must say. Okay. So now let's go ahead then. Um, no point of asking questions like these. So, when we talk about your basic periodontal examination, what basically it is. But let us discuss few things first. First thing is, what is probing depth? Now, I hope everyone knows what probing depth is. So, probing depth, I'm going to go from the basics because I like starting from basics so that it's easier for you to understand, especially to those whose score is 0, 1, 2. Okay. So, when I talk about periodontal depth or probing depth, I'm talking about a marking which starts. What happened to my. 1 second, my pen. Yeah, coming back. So, when I talk about probing depth, we are saying from the gingival margin till the base of the pocket, and the reading is going to be 1 to 3 millimeter if we are talking about the health of the gums being normal. Now, if the value goes higher, like 4 millimeter or above that, we say it's a periodontal condition, and that is concerning for us. Okay, so now to check what the situation is for the patient, how the health of the gums are for the patient, what do? We do a scale, we do something which we call it as basic periodontal examination. That is your BPE. Now, when we talk about your basic periodontal examination, we are going to assess the gums and the bone and the teeth and how they look like, right? So, periodontal health by this. So, I want to ask you guys, what tool do we use for this? Especially to someone who has mentioned 7 for perio. Very good. CPITN probe. Your CPITN probe is also called as your WHO probe, which has a ball at the end and then it has 2 markings on it. That's the probe that we use. So, that's how the marking on your BPE, your WHO probe looks like. So, there is a ball at the bottom whose size is 0.5 millimeter. Then from the bottom, from here till the first marking is 3.5. The reason why I'm discussing about this is because that will help us to solve everything. That will help us to memorize or just understand this concept today. So your 0.5 mm is this ball. Then we have from here till here to be 3.5 millimeter. Then this is 2 millimeter total. So from 3.5 to 5.5. Then this will also be colored. This will also be blackish. So 8.5 to 11.5. That's how your WHO probe looks like. Now the force, if we talk about, if we are going to use our probe, how much is going to be the force? Does anyone know how much should be the force for that? For any instrument that we use for checking the probing depth? It's okay, I'll tell. So it is going to be 20 to 25 gram of force. There's been a question in the exam before, so please remember that. If you have options like 20, 25, 30, something like that, select 25. Okay. So in different references, it will be mentioned 20 to 25, and somewhere it will be mentioned 25 gram. So that is going to be the force that we use to move around the gums, around the teeth, to see how the how exactly is the depth. Now why don't we put a lot of force is because we do not want an error in the markings, the readings, as well as we do not want to hamper the gums which are around the tooth, because if some issue happens, we know what can go wrong, right? So that's why we are not going to put a lot of force. And so what tool we have discussed about it. Now we need to discuss about how this is going to be done. Very good, Dr. Stalin. That's a correct answer. So, how we are going to do? Let's look from the next slide. And we are also going to compare between your adults and peds patient. There is slight variation in the method that we do. So, let's understand this concept. Now, before we go on to this slide, let's look at this diagram and understand. So, what happens is we generally divide our teeth, are all the quadrants and all whatever teeth are available, into six areas that we call as sections. Okay, and so your first section is going to be this one, that is your 1 4 to 1 7. Then we have 1 3 to 2 3 as the second section. Then we have third section here, fourth, fifth, and sixth. Now we do not include your 2 8 3 8 4 8 5 8. Why don't we include our wisdom? Is because they have their own wisdom. We don't want their wisdom in our calculation, so we are going to avoid that. Okay, so we have six sections that we are going to see. And what are we going to do now? For that, let me go back. I just need to so if this is your tooth, we are going to go around, we are going to check 6 points around the tooth. So let me draw a tooth first. So we are going to go around the tooth and do the markings for all the teeth in your mouth. Where exactly are we going? We are going into 6 positions. So 1 here, 2 here, 3 here, and on the back side as well. So 1, 2, and 3. So if we are doing on the buccal side, if this is mesial, this is distal. So mesiobuccal, buccal, distobuccal. And on the lingual side, it will be distolingual, lingual, and mesiolingual. I hope that's clear. Okay, so 6 points we are going to check. 1, 2, 3, 4, 5, 6 for all the teeth in that area. Now when we measure that, we'll get some readings. Now what are the readings going to be? It is going to be 1, 2, 3, 4 or star. Okay, I'll explain one by one all of them. I want to make it as simple as that, so let's go slowly. Or I can put X. X means there is no tooth in that area. Then we have 1, 2, 3, 4 and star. So what does 0 mean? We can put 0 as well. 0. So 0 means everything is okay in the mouth, no issue at all. All the teeth are fine. There is no bleeding on probing, no calculus, no issue like the probing depth is also okay. It's in 1 to 3 millimeter. That's what 0 depicts. When I talk about 1, now let's see what 1 means. 1 means there is bleeding on probing. Why does 1 comes out to be 1? Is because bleeding on probing is the first sign of any gum condition. Any bone, gum condition, anything, we start with bleeding. I hope I'm going fine. Any doubts till yet? Okay. So let me slow it down. I feel It should be as simple as that. So, okay. So I'm going to tell you one by one. So from your 1 4 to 1 7, we are going to put marking here. From your 1 3 to 2 3, we are going to put marking here. 2 4 to 2 7 here. 3 4 to 3 7, 3 3 to 4 3, and 4 4 to 4 7. And we are going to mark for all the teeth. We are going to check for all the teeth, and whoever comes out to be the highest, we'll put that score here. So we are not going to put for all the teeth like 1 2 3 here, like that. We'll put only one score there based on whoever has ranked the highest, whoever is the winner. Okay. And to include in this box, to get inside this box, there should be two teeth in one sextant. So if this sextant has two teeth, then only we are going to consider that. If only one tooth is present, for example, these teeth are absent and only this one is present, only your 3 7 is present, then what are we going to do? We are going to put it in the adjacent sextant. So we will take the score of this tooth in this sextant. We are not going to put it here because there's only one tooth. Poor little one tooth. Okay. So that's what we are going to do. And based on these, first we identify what are the tooth, how many teeth there are in this location. Then we start putting numbers on it. And how do we number it? Based on how much we are going down. So what is the probing depth? Is there any plaque? Is there any calculus? Any overhangs? When I talk about overhangs can be from your restorations. Your calculus is also like an overhang to us. Okay. So any overhangs or any restoration overhangs or any calculus, that means bacteria is going to sit there and cause further problem. It will lead to gingivitis, periodontitis, like that. So that's why we go slowly, we put markings like that. So 0 means no issue at all. Patient is doing everything right. No bleeding on probing, no calculus, no overhangs, and the probing depth is less than this marking. Okay. I hope it's clear. Okay. Now, when I say 1, what does 1 mean? Bleeding on probing. As I said, that's the first sign of any periodontal condition. That's why bleeding on probing is going to come 1. Rest everything is normal till yet. And your black band is completely visible. This is still visible. Then when I talk about number 2 on the BPE score, that means bleeding plus minus, but main thing is your calculus is there or your overhangs is there. Now when your calculus and your overhangs are there, that means your bacteria is going to come and sit there. They are going to stay there. They are going to start causing problem. So that is the initial thing that is happening. So we give it a number 2. Then comes your score 3. 3 means you are putting your probe inside the gums and it is going inside and it is lying somewhere here. So your probing depth is 3.5 to 5.5 millimeter. That means something serious have started to happen. And we need to cater that. We need to understand what exactly is happening. Okay. So probing depth 3.5 to 5.5. That means your black band is partially visible. If you see in this one, if you see where your probing is, your marking is, it is partially inside and partially outside. Now coming on to score number 4. Now when I say 4, that means my probe has gone down, it has gone inside, and this part is not at all visible to me. Now if this part is not all visible to me, this is just gone, that means it is concerning for us. The probing depth, your pocket, is too big for us. And if the probing depth is so deep, that means bone destruction has already gone through. The patient needs some treatment for that. So far, everyone are able to understand, or do you want me to repeat something? Thumbs up if you're able to understand, thumbs down if you're not able to understand. I'll explain again. Okay, good. So, and if suppose furcation gets involved, we give star on it. Okay, so how do you check your furcation? First, you're going to check your probe and you're going to move around. Then you can use your neighbor's probe. You can check how much is your furcation. So that's how you check your furcation. But here you are using your instrument. You're going to go with CPIT and you're going to measure and put all the scores into this box. Now, when you have put it into this box, this is like a standard thing that you'll have it with you. Whenever you refer the patient to someone, you will get the same box with you. And as in, if I've referred my patient to someone else, I can always see what is going on, what is the issue, and I can treat based on that. Okay, so these are the scores that we give. Now, give me 1 second, everyone. Okay, so we have discussed about this part till yet. 1 second. Any doubts so far? Okay, so let's go ahead. So now we have scored it 0, 1, 2, 3, 4 and star. So now we know the situation of the patient. Now we are going to identify what should be the treatment that we need to do. And that's why this basic periodontal examination is used, because we need to identify what should be the treatment for the patient. Also, we need this information so that we can educate the patient on this. So now this was for your adult patient. For your children, this is what we do. So screening for children, we categorize them into two. One is the first age is 7 to 11 and the other grade, the age group is 12 to 17. Now that's the two categories that we are going to talk about, 7 to 11 and 12 to 17. So these are the people who are we talking in this slide. So 7 to 11, when we talk about, they are the people, they are children who will, for them we are checking, are they able to brush properly? Are they removing all the plaque from the mouth? So that's why we give them number 0, 1 and 2. And in fact, they have mixed dentition. So that's what we are going to do for them. We are not going to use 3 and 4 and star for them. Also, we know that in your children, they do not have periodontal condition. If they have any periodontal condition, it means that there is some systemic issue happening and we need to refer further to GP, that is then general practitioner, periodontist or periodontist, to get it checked, to identify what exactly are they going through. Now, when I talk about your 12 to 17, we are going to use full range, that is 0, 1, 2, 3, 4 star. Okay. Why can we consider in them is because they can also have aggressive periodontitis. Now, when we are talking on these, we are looking at, we have put it and we are looking into specific teeth. Now, in children and adolescents, we are not using all the teeth. Here, we were looking at all the teeth from all the quadrants. However, here when we look at, we are going to look at specific locations only. That is first molar. Then you look at your central incisor. This is also from the right side. So, which tooth is going to be? This is going to be your 1, 1. Then your upper left, that is your 2, 6. Then your this side, if you see, lower left 6, lower left 1 and lower right 6. That's correct. That's what we are going to do. So for your children and adolescents, we are not going to use all the teeth. We are going to look at only specific teeth. But when we were talking about adults, we were looking at all the teeth, all the 6 points, whichever had the highest marking, we used to place it in this box. Till yet, everything clear or any doubt you want me to uh, say anything again? Thumbs up, thumbs down? Okay, perfect. Great. So, if we compare your basic periodontal examination till yet what we have done, it can be either for your adults or your children that we discussed. That's the comparison. So for your adults, we did for all the teeth. We checked all the teeth except for the teeth who have wisdom. Okay, and only in specific condition we consider those wisdom teeth only when the 6 and the 7 are missing. Then when we talk about children, we use these specific teeth, and we used only these teeth to check the condition. For 7 to 11, we are only going to use 0, 1 or 2. For your 12 to 17, we are going to use all the numbers, but only these teeth. You are going to walk the instrument around the sulcus or the pocket in each section, and you score only the highest number. Here you only score the you have to score and put it for all these teeth in these quadrants. Okay, in these sections I mean, sorry. So how to use your we don't have to read this, we are just going to go here exactly same in lines. Okay, so when you have score 0, that means everything is going fine, no issue with the patient, nothing, just patient should come for general routine checkups, nothing is an issue, everything is going fine. Now when the BPE score is 1, that means there is plaque and gingivitis charting and oral hygiene demonstration you have to give to the patient. So you will tell them you have to brush twice, you have to floss, and if there is a gap in between the teeth, you use, what do you use? Interdental brushes like Pixters. That's a brand here in Australia. Pixters. You can Google it and have a look how it looks like. Now, so for 1 there was bleeding on probing. Now in score 2, what did we find out? We found out there was plaque and calculus, or there were some overhangs. So if there was some overhangs, we are going to correct that overhangs by correcting the restoration if there is. If there was calculus, we are going to remove that calculus. Now because here the patient have supragingival plaque and calculus, we can do the treatment, we can clean, we can use our scalers and clean that. Okay, and if suppose there is subgingival calculus, we can clean that as well. Now when we talk about your score number 3, when there is score number 3, what was score number 3? What was score number 3? Score number 3 was probing depth 3.5 to 5.5. That means your this is somewhat here in between. Okay, so when we are talking about this, that means for that particular section we are going to do full periodontal examination. We'll discuss on that. So we'll do full periodontal examination wherever the score comes out to be 3. Whereas for the rest of them, if the score is less than that, what are we going to say? Same things for general health. So that's what we are going to say is clean your mouth, do brushing twice in between cleaning, come for follow-ups. That's all here till that we are going to say. Actually that we are going to say for every patient. In any score you are going to say the same thing. That is the basic thing that we are going to say. But with increase in the score, we add one more thing to it. So if it was score 1, we were just talking about oral hygiene instructions and all. In 2, we also said you need scaling, you need cleaning of your teeth. In your score 3, what we are doing, we are also doing a charting of that area. We are going to check bleeding on probing and all those things in that particular section. However, when the score comes out to be 4, that means it's a concern for us. Patient needs to get cleaning, needs an active dental treatment where we are going to check, we are going to evaluate, we are going to do all full perio examination, plus we are going to refer to the specialist. Now your new TG says, initially TG used to say, if you see 4, just refer to specialist there and there. Now your new TG says, first you do the treatment, you do your supragingival, subgingival cleaning, and then you refer to your specialist. So that's your score number 4. So what are we going to do? We are going to go do full periodontal examination of all the teeth. We are going to give patient instructions, what they have to do at home, cleaning, brushing, flossing, all those things. We are going to do the treatment as well. So all these things will come when the score is 4. And what was 4? 4 was when our probe went from this pass. So it surpassed this level and it is somewhere here or here or here. So anywhere here it is. Okay. I hope I have not made anything confusing. Everything going fine? Okay. Now, when I give star, star means there is furcation involved. That is, oh my god, just think, if a furcation gets involved, what is concerning is patient can lose the tooth, right? So, for that condition also, we are referring to the specialist. So, this is what we interpret from your periodontal examination that we do, the scores that we get 0, 1, 2, 3, 4 star. Based on that, we decide on what treatment the patient needs to get. Now, when I talk about your full periodontal examination, what I'm concerned, what am I looking at? I want to see, is there any recession? I want to see what are the probing depth for every location. I want to check bleeding on probing, is there anywhere? I want to see any mobility is there. All these things are going to be there. I will check how much is the furcation as well. I'm going to use a periodontal chart and I'm going to use that. Now, in your periodontal chart, there are boxes where you put all the information, your probing depth, your clinical attachment loss, your everything will be there, right? So, why are we recording all these things? One is to educate the patient that, okay, these are the issues. Now you have to work on yourself so that you can control the condition, or if it deteriorates, we have to refer to specialist. We might have to remove the tooth out. The tooth might become wobbly. All these things come because we are educating the patient that these issues can happen. Now, inform your treatment choice. Patient has a choice. Patient should be informed about everything. That's called consent taking, informed consent, where you tell the patient every single thing. You decide, can you do this or can you do that? So, what is important in your perio is active treatment, that what we and your specialist is going to do, and maintenance is really important for us, because if we are not maintaining anything, the condition can further deteriorate, and that's what we need to tell to the patient. And we need to monitor the treatment outcomes. Now, once we have done a particular treatment like supragingival or subgingival cleaning, we need to monitor that as well. How the patient responding to it? Is there any changes happening? Are the gums coming back to normal? Is the bleeding on probing stopping? Is the calculus plaque there less now? Or is it still there and it is further causing destruction of the tissues around? So for those reasons, we do your periodontal examination, your BPE scoring, and for your medical legal reasons. Why medical legal reasons? If suppose I say I have explained this to the patient today, after 2 months, the patient loses one of his tooth, and he can come to me and he can say that you did not explain me anything. So that's why you chart everything, you keep it everything. I know you all guys know about it. So you do that properly so that no one can point out and can say anything to you that you are not maintaining, you did not do anything for the patient. So that's why for medical legal reason we'll do that as well. Okay, so probing depth, how are we going to check? With your UNC probe, your Williams probe, your PCP probes. There are different types of probes available in the market. You can use anything, and by that you can check how the probe being depth is. Now, this will tell us how good the condition of the patient is for short term. Plus, your bleeding on probing, as I said, is the first sign. It will also show us if the things have improved or not. And our main concern is, if suppose a tooth had 6 points and all the 6 points had bleeding, we have to reduce that. So, two things we need to do. One is the probing depth should reduce for the patient, and the bleeding site should get reduced. You can refer to your therapeutic guidelines for all the information that is really going to help you out. And based on your periodontal bone, your BPE scoring, when you understand that, and then when you go and read your staging and grading, things become really clear to us. It it falls into position that what are the situation, what are we doing, and what we are not doing. Now there is something called tips. Now what is tips? We are what we are doing with the patient. So this is for the prevention. We are telling the patient, that is, we are talking to the patient about the periodontal diseases, about the barriers, about the risk factors. What are the risks? What could have been the risk for causing this problem? We instruct them, we give them instruction what are the best ways to perform any treatment. Effective plaque removal, how could that be done? We discuss about how we can practice it by cleaning teeth using interdental brushes properly, and we plan how the patient will incorporate oral hygiene into their daily life. And we provide follow up, that is, we providing support. If suppose patient is smoking, we give them quit line number, we explain them what are the harms of it, we discuss if they have stress, they have osteoporosis or any health issue, how they are linked, we discuss all those things. So for your BPE 1 and 2, what we were doing? We were doing non-surgical periodontal therapy and dental prophylaxis at risk-based intervals. So basically we are going to do checkup and clean for all the patients. We are going to do thorough debridement of the patient. Now when we were talking about your 3 and 4 and star, full perio examination. So I hope you know now. 3 means only that section we are going to do your periodontal examination. Your 4 and star we were doing for your whole mouth, wherever it comes out in the box. Okay. So we do non-surgical periodontal therapy, that is debridement. And once that has been done, then we do our supportive, we refer to the specialist if the things are not working out. Along with that, we also do your supportive periodontal therapy like giving chlorhexidine to the patient. Okay. Now, I hope you know your chlorhexidine is not going to remove whatever plaque is present there, but is going to avoid further plaque formation, further deterioration of the condition. However, that is to be taken only for how much time? If we write it to the patient, how long is the chlorhexidine that we give it to the patient? Anyone? No reply. Is anyone able to hear me? We give chlorhexidine for 2 weeks. Okay. Why do we give only for 2 weeks? Staining happens. Okay. So these all issues happen. That's why everything has, if you give something for more, time, obviously anything can cause something. So it causes your staining of the teeth, although that can be removed by proper scaling. Now, test time. I want to check everyone how you guys are doing, if you understood the concept properly. So let's start with this first one. My question, what is this? Out of 0, 1, 2, 3, 4 star, what are you going to give to this one? Where are others? I want everyone to answer. I'm not going to judge you if you answer wrong. I want everyone to answer so that I can see you are understanding or not. This is your platform where you can share whatever you think. Don't worry, I am never going to judge you. But I want you to learn everything. You need to understand the things correctly. That's what I want for you. Okay, so let's see the answer. What does it be? So, Dr. Stalin, Dr. Arindam, Dr. Kulsum, and Dr. Dev. Answer is correct. It's BPE score number 0. Now, what about the second one? The second picture here. You can write any answer, it doesn't matter. I want you all to at least write the answer so that I can see that you are hearing to me. Any doubt, I will repeat it again. Don't worry about it. But this concept should be 100% clear when you go back from here. When you go and solve the question, if you see like this, I want you to answer it, whether you be a part of Soul ADC or not. Everyone, please answer the question. Do you guys want me to go back and explain you? It's okay if you're stuck between two numbers. That's fine. Just give answer. That's what I'm saying. Okay, I can see 3 and 4 mostly. More answers. One was 2. Okay. So, we know we have 2 here. We have 2 colors, 2 markings here, 1 and 2. Right? So, here, how much can you see? Can you see the first one? We can't see the first one here. We can only see the second marking here. That means it has gone beyond a point. It has crossed this point and it should be 4. Kudos to all of you who have answered 4. That means it's clear to you. Next one is 3. Okay, anyone else? I want more answers before I go ahead. Okay. 3, 2, 3. Okay. So, one marking we can see, the other marking we see it partially. So when it is partial, it means it is lying between 3.5 to 5.5. Okay. So 3. Yes, partially visible. 3.5 to 5.5 means it's score number 3. So that's how you score it. Okay. Now next one. If you want, I can zoom it for you. Okay. More answers. I want to see more answers. Okay, good. Yes, it's BPE1 because there is bleeding on probing. We can see that clearly, and there is no plaque. I can't, sorry, there is no calculus here. I can't see calculus, so I can't give it score number 2. I will give it 1 only. Okay, now what about the next one? Okay, everyone is intelligent. Yes, it is furcation. So we are talking about furcation. That's your neighbor's probe. It is curved. It helps us to identify how much is the furcation. Though we are checking with this probe and we can see that there is your furcation involved. Now what about this one? Very easy. Okay, I'll zoom for everyone. Okay. Now you can see your these parts are out. Definitely it is not 3, it is not 4, it is not star. So what are we left with? 0, 1 or 2. Okay, good observation. There is calculus here. So when there is calculus, we will score it as 2. When there is no calculus, we could have scored it 0 or 1 based on bleeding present or not. But because there is calculus, be very careful with your photos. Very mindful. If you miss a little bit of it, your answer can go wrong. So if you can see calculus is there, just mark it 2. That's why a mirror is at the back to show you there is calculus here. Okay, I hope the BPE scoring is clear to everyone. Anyone has any doubt, anyone wants me to repeat anything, I can do that as well. Please ask me so that when you go back, no concept should be, nothing, even a single word should be not in your mind. Any doubts so far? Anything you want me to repeat? Perfect. Okay, great. So that's all for today. We have completed this topic. Anyone, whoever feel they have any problem anytime, you can definitely contact me. Doesn't matter you are part of Soul ADC or not, but we do offer courses which we have structured it into 8 modules. Your 1 to 7 module is the one where we discuss about your topics, we discuss about everything. We have BPE here as well. And in fact, you'll get further more details in our sessions, which are pre-recorded. Modules are there which have all the pre-recorded information, but I also give one-on-one explanation if you have doubts anytime, because for me your passing is what is important for me. If you pass, I'll also pass. I tell this to everyone because I take all the responsibility in explaining, in going through everything. You get all the references, whether it be from an ADA, BDJ, or the books which I've purchased as well. You get everything in the course. You just have to freely listen to the sessions, understand those concepts. If you like my understanding, you'll definitely understand the sessions as well. And you'll get all the notes inside the sessions. You get pictures, videos, all those things on that to make it as creative and as understandable as possible. And um, we do therapeutic guidelines, we do topics. And if you have ever, you feel any doubt, I am there. Even if there is any nervous breakdown, I'm going to be there. Yes, you can book for one-on-one. You can talk to me and I can definitely book a one-on-one for you. Okay, thank you so much everyone for joining in today. It was really nice to see that everyone were able to answer the doubts, answer the questions that I asked. Any issue, you can, as I said, you can always contact me. Thank you so much. Do we have mock exams too? Yes, we will have mock exams. We do mock after every module, as well as in your module 8 here. We will do mocks. We will do your past papers. We do revision, everything in module 8. But we'll do one or two mocks in every module. But I will not give you mock before you complete everything, because if you do it before, then you are going towards rote learning. You are not going against and going towards basic concepts, because questions can come from anywhere. They are not going to check all your past papers and do that. They are going to take it from anywhere, and we need to be prepared for everything every time. Because I not only want you to pass part 1, I want you to pass part 2 with this training only. So when you have basic concepts correct, your communication will be perfect. No one can stop you from passing as well. Okay? So thank you so much, everyone. See you next time. We'll decide a topic. You can write me down whatever topic you feel you want me to discuss next time, and we'll break it down and make it as easy as possible. Thank you so much.